Welcome to the How Dentists Get Paid podcast. I'm your host, Racheal Grant, and I have spent my entire adult life in the dental field. I'm excited to be interviewing dental industry leaders and innovators to learn their best tips and practices for success in the dental field. So whether you're a new dentist fresh out of dental school or a veteran provider with roadblocks ahead of you, this podcast is for you. So let's jump right in with our guest speaker and explore how dentists get paid. So we are going to be showcasing two wonderful industry-leading oral surgeons. I'm so excited to introduce them and just have that Q&A about their specialty and how we can kind of learn from what they have experienced throughout their journeys. So we're going to go ahead and introduce Dr. Benjamin Kerr and Dr. Brandon Greer. Welcome.
Thank you. Thanks for having us.
Thanks a lot.
So excited to have you. So just real quick, I want to introduce both of you. Dr. Kerr, you have been practicing in oral surgery for 10 years and are that sought after expert in innovations in the field. So I'm super excited to learn more about that journey. Dr. Greer, you are a board certified dual degree oral maxillofacial surgeon, native to Kentucky, and completed all of that training in Kentucky. So that's super awesome. I would say go sports team of Kentucky, but I can't think of what they are. So I'm sure you can fill in the blanks there.
Yeah, right.
So first, I would like to really just get started learning more about each of you. So Dr. Greer, I'm going to go ahead and have you get started and just tell us a little bit more about yourself and your journey in the dental industry.
Sure. Yeah. So as you mentioned earlier, I grew up in Kentucky. I went to high school here, undergraduate at University of Kentucky, and then went to Louisville for dental school and oral surgery training. From there, I joined a group practice and then transitioned out of the group practice after a couple of years into a solo practice, and I've done that since 2014. And I maintain a full scope oral maxillofacial surgery practice in Bowling Green and Owensboro, Kentucky. Just staying, active in the community and have 3 wonderful kids and a wife at home that keep me really busy, and just love the outdoors and, spending time away from work as well. So
that's so wonderful. Well, we are so excited to learn more. And Dr. Kerr, tell us a little bit more about yourself and what you've done throughout your journey in the dental field.
Sure. I started out at the University of Michigan, go blue, and after that I went to Stony Brook Dental School, and then Albert Einstein Montefiore Medical Center for my surgical residency. Similar to Dr. Greer, I joined a practice as an associate just for about 12 to 13 months after residency, and then went off on my own. And that was in 2009. So we're about 10 years into this journey, and it's been a lot of fun.
Yeah. It's been a ride, huh? And I'd like to go ahead and transition, Dr. Kerr, why did you choose to pursue oral surgery, above any other specialty?
I mean, that's a good question. In all sincerity, I never wanted to be a general dentist. I had always had a mentor. His name is Steven Sachs. He does full scope maxillofacial surgery, and he took me under his wing when I was young, even prior to dental school. And I saw how he changed people's lives with craniomaxillofacial surgery, even something so simple as implants and wisdom teeth. And that really pushed me. And after I had gotten into dental school, I did several stints at Jackson Memorial in Miami, where I worked under Dr. Marks and Dr. Carlson and others, and really got a feel for the specialty and fell in love with it. So it's my passion. But I'm equally passionate about my family and my kids and life, but it has afforded me the ability to live a good life and practice. And, being in solo practice, as Dr. Greer could tell you, is fun, but you don't really have anybody to bounce ideas off of. So you're pretty much on your own. And I think one of the benefits of eAssist is that I have a team that I could always talk to. And that's been great.
Right. It takes an army to build a successful practice.
Without a doubt.
For sure. And what about you, Dr. Greer? I'm curious to learn, what caused you to pursue the path of oral surgery?
Yeah, that's a great question. I've got a couple of relatives in the dental field, including my mother. So my initial plan was to, do dental school and join her practice. And um, I guess I didn't really appreciate the dental specialties until I got into dental school. And then once you get your hands on doing, bending some wires in ortho class or doing some root canals and stuff like that, you don't really, it's hard to appreciate what you like and don't like. And then thinking in dental school that oral surgery was mere pulling teeth and, doing some implants, there's a whole world in addition to that I had no idea until I spent some time in the residency at Louisville. And then from there, I did some externships at some wonderful programs and got some hands-on experience. And then from there, like's already been mentioned, you make a difference in a lot of people's lives by doing a lot of these surgeries, and there's a need for trauma surgery and care that we can provide. So it was a hard decision for me. I think Mom had a little. She was want me to come in there, but I found this other passion, and it worked out. So I'm happy where I'm at, and it's worked out really well.
Plus, it's an easy referral source for you.
Yeah, exactly.
Keep it all in the family. Yeah. Well, and how nice to know that you both were inspired from, different sources, and then it led you into being able to do this passion on a daily basis and really give back to the community, which is always, makes it nice to lay your head down at night for sure.
Of course.
So I want to go ahead and, talking about the communities, the relationship between a general office and an oral surgeon's practice is very important, and that, kind of fluidity back and forth on the referrals and, looking into forms of treatment, what's going to be the best for that long-term prognosis. How would you say you integrate yourself in the community with those general practitioners, or for any general doctors listening, what would be some of your great tips to integrating into their oral surgeons in their community?
Well, I guess first and foremost, ingratiate yourself into the community. Be part of the community in which you practice it. Be good at what you do. If you're good at what you do, success will always come. As far as the general dentist and the relationships, I don't button myself, into a hole where we just get referred patients from general dentists. As Dr. Greer could probably attest, we have patients from ENT, plastics, microvascular reconstruction. However, the relationship that we've established with general dentists is you want your patients to get a predictable and successful result. And if you work with the right people and have communication, that will occur. And the communication is key. So if my referrals don't know what type of implants I placed and the patient shows up to the office for an impression, that's not good. So I think what we really evolved together as a community is to be in communication. And we've gone so far as to put things on a cloud securely so that at any point in time, the GP or whoever can access that patient's files securely and figure out exactly what needs to be done if there's any questions.
That's wonderful.
I mean, do you agree, Dr. Greer, communication?
Oh, yeah, for sure. You hit the nail on the head. Being integrated in the community like that and caring for, families that you don't just see at the office, but you have relationships with outside of the office, as well as family members, and then word of mouth gets around, and then doing a great job. I mean, like you mentioned, that's what it's all about. And then that breeds confidence with your referring doctor, and that breeds confidence with your patients. And then before you know it, a lot of my referral base now is just word of mouth. Patients have a great experience, and they share that with their dental colleagues and friends and things like that. And it almost, it does it itself. On a soapbox just for a second, there's lots of great dentists out there, and there's a lot of financial obligations that we face as dental professionals in dentistry and oral surgery. And, our motive always needs to be what's best for the patient. And, we put in a lot of time and effort to be, very skilled in our profession, and doing certain surgical procedures and things like that. And as dentists, we don't need to lose sight of our dental specialties and dental professionals. We're not there to take business from dentists. We're there to help with their care. And really, when dentists really get a feel for that, it becomes a really good experience for patients, and both businesses benefit.
I agree wholeheartedly.
Absolutely.
And when you can share, you have to share something. So you share the risk, you share the reward.
Exactly.
That's pretty much my philosophy.
Right. Absolutely. Now, one thing I'd like to always ask, especially, just interviewing doctors that have been successful in their own practice, if you were able to talk to yourself when you were first starting out, what would be that best tip of advice that you would give, anyone that's listening?
Honestly, I would have a partner like eAssist when I first started, because the back end of the business is something that you have no idea about when you graduate residency, even if you're an associate. And having that stable back end that's monitoring what you're billing, what your insurance, what the patient portion is, has been revolutionary. And yes, assistants are amazing. You cannot do anything without assistants and front desk coordinators. But if I was talking to Benjamin Kerr 10 years ago, I would have had all of this set up ahead of time. And when I stumbled upon it, right, when I became part of the assist, it just opened up a whole new world for us. My staff was able to concentrate on patient care. And patient care was lacking when you're looking at billing and looking at claims. And if you really want to build a practice, you need to be one-on-one with the patient, and you have to separate the billing from the office. That's just the bottom line. I'm sure Dr. Greer could attest. Any patient that asks you a question about billing, you don't have any idea about. However, if you have a professional service where you could facilitate that, such as eAssist, it makes it that much easier.
Right. And really allow you to focus on the treatment and the specialty while you're there. Yeah.
That's right. And and we've grown productively with eAssist.
Right. Well, and what about a newly graduating Dr. Brandon Greer? What would you say to that fresh phase, optimistic coming into the field?
Sure. Yeah, that's such a great question. And, it's so funny to look back and, to echo a lot of what Dr. Kerr said, it's, having resources available. And through our lives, we can probably remember the age of the flip phones, and now to the iPhone, and now technology is at our fingertips, and things like the eSolution is just another step on the ladder for us, another chip on the old block that we can go to if we need that extra help or assistance. And as new business owners, that's one thing we don't get trained of in dental school. And that's one thing I really wish I probably had a little better background in. And I wish dental schools would do a better job at trying to prepare, students for things like that. And there's a lot of financial decisions. So I think it's really important to early on establish yourself with a good support network, and just have some available resources that can help you along the way. The patient care, Dr. Kur and I have had some great training. We're very skilled surgeons. We do a great job. There's no doubt about that. The patient care is going to be there. It's, doing the right thing and surrounding yourself by the right people that can help you get to where you want to be.
I agree.
And that's great advice too, just building that solid foundation. I want to ask for anyone listening, especially if you have any questions, please drop those in the chat. We'll kind of be transitioning over to answer any of those questions here shortly. But flipping it from the business perspective, what would be maybe your top one or two clinical advice for any providers listening that may be also doing oral surgery in their practice?
Right. I think you need to keep up with technology. You need to keep up with academia, the literature. You need to do evidence-based practice, right? You need to be thorough with everything you do. That's really, the gist of it. You need to practice in gold standards, right? If you're doing an implant, You're not taking a panoramic x-ray, you're taking a CAT scan. And nobody could fault you for going that extra mile to make sure that the planning is correct, that you're a far enough distance away from the nerve. And this goes for anything. You know, if you practice the way that you want to be practiced on, I don't think you could fail.
Great. And Dr. Greer, what would you say as far as any kind of clinical advice or anything, you know, once you've established that foundation of building the practice, kind of that next level advice, you know, going from there?
Yeah, no, that's a great question, and that can open up a whole array of things, from soapbox talks to to really you know, lifelong lessons. But I'll stay with, you know, as Dr. Greer coming out of dental school many years ago, coming out and telling me that I was going to sedate patients and place dental implants out of dental school, it would be a crazy notion to think that we could do that. And when we talk about the rigorous training that Dr. Kerr and I did, you're talking about an extensive amount of time, from 4 to 6 years, to learn surgical specialties and how to deal with complications. You know, that's a lot of my main thinking as far as surgical procedures. You know, Dr. Kur and I could probably do a lot of general surgery procedures. We can probably do a lot of ENT procedures because we did those rotations. That doesn't necessarily mean that we're going out and doing those, because there are people that are more qualified and better suited to do those. So I would tell dentists, especially starting out, to stick with the bread and butter, stick with the easy stuff, stick with the stuff that you're really comfortable with, use available resources. And remember your specialist. That's the reason they do the extra training. That's what they do. Your patients will appreciate you for that. And that's why we're here. That's what drives us. That's what keeps us busy. That's how we build relationships. And, you know, the second thing for dentists is don't be scared to reach out to your oral surgeons. You know, I have lots of dental friends that will, you know, we go out, we grab dinner, we grab drinks, whatever, and have a good time. And we'll talk about dental problems. And it's funny, you'll build a lot better comprehensive care plan for patients when you really strive to integrate those different specialties within your patient base, and you know, not get caught with being you know, trying to do a little too much. And you know, the last thing I'll mention is just economically. You know, we all know that the cost of dental school has gotten astronomical. It's almost to the point where dentists can't afford to come out and buy their own practice from the get-go. It's hard to get a loan. It's hard to establish themselves, and I understand the frustrations of trying to make a living doing that. But you know, my big word of caution is never get greedy. Do the right thing for the patient. Don't be scared to refer out those hard cases. And we're there for you. We're there to help.
Yeah, and just to add to Dr. Greer, and he makes excellent points. If you do a surgery and you can't manage the complications, then you shouldn't be doing the surgery.
Exactly.
Right? We could harvest a hip to do reconstruction, but if you can't manage the complication of harvesting from the hip, then you shouldn't be doing it. Not to say that general dentists shouldn't be doing surgery or implants, but if you're adept at it and you can manage the complications, great. But I think there's a lot of work for everybody to go around.
Sure. Well, and let's transition. Obviously, this last year has been a doozy for everyone, even more so for the dental industry, and kind of that upfront personal connection that we have with patients, and you know, the risk that plays. What would you say your opinion is on with patients coming in? Have you seen since the pandemic that they're taking their oral health more seriously, and you know, really kind of wanting to take care of treatment more urgently than prior to? What's been your experience?
Well, if you don't mind, Dr. Greer,
not at all.
Our office has been probably one of the only offices in the country that was doing rapid PCR testing months ago. And we established a protocol and developing a white paper whereby every surgical patient is tested preoperatively. And this builds upon what we could do as dentists, as a community, because point of care testing is not just going to be relegated to COVID. We're going to do point of care testing for strep and flu and cardiac enzymes and hemoglobin A1C. And this point of care testing and treatment is going to save a lot of money to the overall healthcare system. Because if we could catch somebody, with a stenotic valve or A1C that's 9%, we're going to be able to catch it and nip it in the bud. And I think as dentists, no matter what specialty you are, you see those patients more than any other doctor. And as a whole, I think it's part of our practice now to focus on the systemic patient and not just the oral care. And I do believe that transition will take place. And I implore it. I really do. I'm sure Dr. Greer could attest.
Yeah. That's, going back, and I totally agree with you. And that's awesome that you were doing this point of care testing and had those resources available. It's interesting to hear different geographic areas and what's available for resources as far as that stuff goes. And here in Bowling Green, Kentucky, it's very limited access for that.
Well, you got to know how to get it. You got to know how to work your way.
Yeah.
From New York, I can talk my way.
I hear a backside conversation happening after this meeting.
Yeah, I'm like, that's some good ideas. But no, to answer your question with the COVID, it was, this was a very interesting time for us. And, it's interesting to think of that a virus can cause this much, economic and impact across all industries, including healthcare. Fortunately and unfortunately for Dr. Kerr and I, we're kind of the bottom of the barrel as far as the dental field goes. So, during the pandemic, how best to handle patients. Well, just because a virus hits doesn't mean that patients aren't going to have huge dental abscesses and they're not going to be in excruciating pain. And yet we're dealing with the virus that we really don't know anything about. So it was very interesting times, and it was scary times. You're caring for your patients, you're caring for yourself and your family and your staff, and how appropriate, that you have to be to treat those. We just kind of followed the guidelines initially. We remained open in practice for, a couple of days a week on kind of an emergency basis, but still cared for patients in the safest manner that we could. And knock on wood, we did really, really well. The effectiveness of just PPE equipment, masks and face shields and things like that, there's definitely something to be said for that with the amount of patients that we had through the practice, and we're able to safely treat those. Hopefully we're on the mend. And, that's one thing about technology nowadays. Who would have thought we'd have had a vaccine that we would be implementing right now? And it's probably just a matter of time, as Dr. Kerr pointed out, before we're able to administer vaccines in our office. And you can think of how many dentists, how many people are being seen for hygiene, for fillings and oral surgery procedures. That is a direct avenue that we can get stuff out there a lot better. So I see the healthcare field and, the things that we're able to offer just expanding and exploding across the nation. So we're able to better handle emergencies like this and stuff that's even more similar. Like Dr. Kerr mentioned with the things as trivial as diabetes and cardiovascular health.
Absolutely. Well, and I think that kind of brings up a good segue into just the future of dentistry. What would you say is your thoughts on where our field is going? And I know, Dr. Kerr, you specialize in all those innovations and like the leading technologies and all of that. I'm curious just to see where you feel like the next generation of dentistry is going.
Well, unfortunately, as Dr. Greer said, a lot of the dental students graduating are saddled with debt. So I do envision dentists and multi-specialty practices being consumed by whether it's private equity or DSOs or MSOs. However, if I'm getting my shoulder fixed at the hospital for special surgery, I'm not going to my general practitioner to get it done. I think specialties will remain specialists. And if you need special work done, you will go to the surgeon. It's a good question. I don't know how to answer that question about where dentistry will go, but I do see a line that's been drawn already in the sand that it's going to be those in private practice like Dr. Greer and myself, and those like Aspen Dental and Heartland and all these other places, Clear Choice. so on and so forth. And that's not a bad thing, right? It's not a bad thing at all. However, I do believe with a strong conviction that if you need surgery, you go to a surgeon. And if you need surgery and you need to be put to sleep, you need to be put to sleep in a surgeon's office, not a dental office. So I just want people to be aware of that. And Dr. Greer and I have heard disasters, right? And we see disasters. And probably 20% of the cases that I do are disasters. And I don't like seeing disasters because the patients are upset. They've already exhausted their finances, and now they come to us. So I think the way dentistry is going to evolve better, and people are going to recognize their lane, if you will.
Yeah. And Dr. Greer, would you agree?
I do. It's a lot of what he's already echoed. Just it really hits home. As far as advances go, I'm going to just switch just a little bit with which I like to think that the Aspens and the Heartlands isn't going to take over the dental mentality. And again, I'd like to think that there isn't something bad about those. They're really good stepping stones for a lot of students and things. My problem with some of the corporate type dentistry is you have people running those practices that aren't doing the work. It becomes a financially motivated business. And we really don't want to have dentistry and, medicine solely, focused on the financial benefits that can ensue with that. But it is an unfortunate truth. There's already some writing in the sand, like you mentioned, and that may be something that's here to stay. I've found that a lot of patients, they really appreciate the mom and pop type dental practices, though, as long as they're available and sustainable. But as we see, the cost of living and the cost of land and the cost of building just keeps exponentially rising around us, as well as college and dental school tuition. And it's becoming exceedingly hard for these students to come out and make it. And, it was a huge decision for me to leave an established group practice and start my own practice and build my own building. It's almost a leap of faith, and that's a hard thing to do sometimes when you have you have a little mouse counting on you at home.
Right.
But I wouldn't trade it for the world. It's the best decision I've ever made. I have office meetings every morning with my girls, and the constant thing is we're going to be the best oral surgery practice in the state. We're going to do the best surgery work, and that's what we're going to be known for. I'm never financially motivated with as far as what I do. I never share numbers with my staff. I don't care necessarily, as long as I can survive and feed my family and things like that. And you know what? It all falls into place if you do the right thing. And I'd like to think that for the future, it will play out. And there will be some more corporate type places, but I like to think that the mom and pop type dental practices will survive and thrive, and people will appreciate having that availability.
Sure. Well, that's so inspiring just to hear both of your stories and your thoughts on all of those important areas within the industry. As we start to close out, I know we started talking about what inspired you to get into the industry. I know today you have been very inspiring to others, as well as myself, on just things that we have talked about. What would you say is someone that each of you would, let me rephrase that. Someone that outside of dentistry you follow, that's a business leader, an inspirational person, someone that just helps to make that impact on your professional career. What would that be, or that one person or book that makes an impact for each of you?
I mean, off the bat, I'll say Elon Musk, because I own some Tesla stocks. So that's
call.
But in all seriousness, you have an individual like Elon Musk who developed this company, and at the same time developed a space company. I mean, the man is a genius. And I can't imagine the amount of hours. We always talk about the 10,000 hours. But the one doctor that I actually am just in awe of is a doctor at NYU who actually trained at my program. His name is Dr. Eduardo Rodriguez, and he did the first successful U.S. facial transplants. And he gave a lecture not too long ago about how he prepared. And he took his team into the cadaver lab and harvested and then donated. And he worked on this for hours and thousands of hours until he got it down to the exact minute between harvesting and placing. And I'm sure Dr. Greer could attest, the more you do things, the better off you are. But Dr. Rodriguez exemplifies the gold standard, the modicum of what a surgeon should be, of what a professional should be. You know, if you want to be good at your job, you need to practice it all the time. You need to be invested in education. You need to be invested in academics. You have to be, let's just say, worldly, right? You need to really, really harness everything at your fingertips. And he is probably one of the best surgeons I've ever spoken to or heard from.
It's great. And doesn't it make such an impact when you hear someone speaking about that profession? You just want to walk out and kind of empower that, embody it, and make that happen in your practice.
It's like they're speaking directly to you.
Right.
You know, and I want my patients to feel that I'm speaking directly to them, and there's nothing else in the way. And I believe that that's paramount.
Absolutely. And Dr. Greer, what would you say?
That's such an interesting question. And I think if you'd asked me when I exited, dental school to where I am now in life, first of all, I'm going to echo the point of all of our people in education, all of our surgeons in education. Dr. Kerr and I would not be where we are today if not for all of those guys. All of them have been instrumental in ideas and research, surgical techniques, and sharing those with us. So we're super fortunate to be in the field that we are, and those guys have molded the way. There's certain people that are cut out for education and research, and unfortunately, I am not one of those, and I will freely admit that. But there are people that love that, and you can truly tell their passion for it, just as Dr. Kerr mentioned with his example. Those people will put in countless hours for the benefit of everyone. And it's usually not self-motivated that they do that. At this point in my life, I would say, somebody that I admire every day is probably my wife. God help her, she can take care of 3 kids and me in my lifestyle. So I definitely, I really appreciate her and the work she does. And, for whatever religious affiliation you are, our Lord and Savior Jesus Christ, I thank him every day for putting me in the position that I'm in and allowing me to care for patients and do the best that I can in this life.
Well, I think every mother had a smile on their face when you gave that little plug of appreciation, because sure is it underappreciated, right?
For sure. Yeah.
Well, it has been such a pleasure to be able to talk with both of you. And just to kind of recap what we've talked about is really starting with that firm, solid foundation, and a support structure that is going to get the practice kind of off of the ground and get it to where you're able to treatment plan that predictability of your success. And then once you've gotten that support structure, really focusing on doing the right things for the right reasons and having everything fall into place when you are purely just supporting that passion and the patients in your community. So is there any last kind of final thoughts that you would like to add before we close out for our session today?
No, it was a pleasure speaking to you. It was great to meet Dr. Greer. I always love meeting fellow surgeons, and
for sure.
I'm sure you and I will cross paths at the next meeting.
Oh, that I'm sure we will at some point.
I'll buy you a beer.
Yeah.
Yeah. Nashville's a short way away. Hopefully we get to have one this year.
That's right. Well, thanks for having me.
Yeah, thanks so much. Appreciate it.
Thank you, guys.
This podcast is sponsored by eAssist Dental Solutions. eAssist helps dentists collect 100% of what dentists are owed by insurance companies. Their dental billing experts work with dentists and their teams to ensure the claim submission process is smooth and that dentists and their staff can focus on patient care. If you or someone you know is in need of assistance with the dental billing process, call 1-844-EASSIST or visit dentalbilling.com to find out more.